My name is Cyilee Martin. I'm a nurse practitioner. I was born and raised in Oakland, Iowa, which is a few miles, about an hour from here. Then I got married. I have 2 kids, moved to Avoca area. I wanted to work somewhere in rural health and heard that Denison had an opening, so I applied over here because I am familiar with the area, and that's how I got here. I started initially as a CNA right out of high school, and then following that I went and became an LPN and then an RN. And a few years following that I went and got my bachelor's degree. That happened at Nebraska Methodist. And then I waited quite a few years, so I was actually a nurse for about 13 years prior to going back to getting my doctorate degree. And at that time, I worked mostly in emergency medicine. And so I became very interested in the clinic and seeing people in more of an urgent care setting, which is what I'm doing here at Denison. So I did get my doctorate degree from Creighton University, and I've been here at Denison for almost a year now. I initially, while I was in school, really liked anatomy and physiology courses. Found the human body very interesting. I'm very scientific and like to get to the point. But then following that, I worked as a lifeguard and enjoyed kind of the aspect of, watching over and caring for people. Always cared for family members, my younger sister, and so the idea of taking care of people and being able to meet them where they're at in life always appealed to me, and so that's how I decided to become a nurse. The most challenging part of working with patients is having enough time in a day to get everything accomplished that you need, especially when you first meet someone. Doing urgent care here, I don't often have a lot of time to get to know people, so I try to spend time, reviewing charts and going through their backgrounds to figure out more about what's been going on with them so that I have a better idea when they get there. But overall, I would say getting everything under control in a small amount of time being urgent care is probably my biggest challenge here. So the most rewarding aspect is getting to care for people and making them feel better and getting to see them outside of here and seeing how well they're doing, or having them come tell you, oh, I've done so much better since the last time I saw you. That is always a great feeling, knowing that you're able to help someone and get them back to their regular routines. I really enjoy the people I work with, my coworkers. Everyone works really well as a team here. I really like that culture and the ability to know so many different types of people and have everyone be willing to help at any time. The culture here has been a lot different than some other places I've been, and I do feel like there's anyone that you can go to and talk to at any time without concern. So I actually really like what I'm currently doing. Doing urgent care has always been my passion. I did go back to school from my nursing to get my doctorate in order to get to where I am today. So hopefully I am here until retirement and get to finish out my career doing what I currently do, which is urgent care nurse practitioner. On a fun note, I am very athletic. I do enjoy sports. I spend the majority of my time outside of here following my kids around to their multiple activities. So more often than not, when I'm not here, I'm on some sort of a field, whether that's a baseball field, softball field, something like that. But work-related wise, one thing I would really like patients to know is that I truly do believe in patient-centered care and allowing shared decision-making. So if you're coming to see me, we will often go through things together and options so that you have the option to determine how your health care goes.